So to be specific, the FUE procedure is a very inadequate, ineffective way to pull hair out of the back of the head. It is. It's called a punch biopsy. You and I talked a few segments ago about the plugs that I had done in 1979. I mean, I want one of the doctors out there that says that the FUE procedure is so superior to tell me why that's not the same exact procedure as I had done in 1979, just with a smaller punch. Well, they might call it some sort of robot, or they might call it something, some neo something, but the bottom line is that's just a tool that the doctor's using, like a scalpel, to do a surgery. The actual science behind it creates an ineffective, inefficient way to remove a lot of hair out of the back of the head and have them all survive. It's just the science.
Gotcha. Now there are good instances and good cases of why you would do an FUE procedure. In my case yesterday, I had my linear scar filled in. However, say if someone is a class 6 or a class 7, that's something that you wouldn't necessarily recommend someone do an FUE procedure.
You know, that's correct. I mean, here's the thing. We talked about it for a little bit about which is more important. Is the back of the head more important than getting your hair back? Because if the back of the head is more important, which doesn't make any sense to me, I mean, I'm not saying that it's not possible, but if you'd rather have circular dots, white dots in the back of your head from FUE scarring, thousands of them, versus a fine, thin, linear line, so be it, then you're an FUE candidate. But what the FUE kind of Kool-Aid drinkers is what I call them out there, and again, I'm not anti-FUE. It just needs to be used in for the right patient, be the right procedure for the right patient.
Gotcha.
So if, for instance, we had someone that came in that said, hey, listen, I don't care that my whole head is bald, I just want a little bit of a hairline. In the old days, we used to call that a little bit of a frontal forelock, where there was very limited donor in the back of the head of a class 7, really bald person. I kind of joked and called him young Frankenstein, like complete bald. So they'd say, well, sir, you're not a candidate, but if you want, we'll put a little frontal forelock where even a little bit of hair on a really bald head makes the guy look a little bit like his face is framed. And, you know, jokingly, that's kind of what you're doing if you choose FUE, because there's just not a lot you can do with the hair, and a lot of the hairs you pull out, because there's so many that you need, are skeletonized and they're not the quality.